Will do.
All right, well, it's 10 a.m. and we'll go ahead and get started. I'm Dr. Samantha Meltzer-Brody, and I'm joined today by my terrific colleagues, Dr. Gala and Dr. Crystal Schiller in the Department of Psychiatry at the University of North Carolina at Chapel Hill in the School of Medicine. Today, we're here to talk about mental health and well-being, a survival guide for COVID-19. And it is our real privilege to try and be helpful to our UNC colleagues as broadly as possible, both in the School of Medicine, throughout UNC Healthcare, the university, and beyond, as we all try and wrestle with this most difficult situation. Next slide. So I just want to give a disclaimer that we are facing an unprecedented situation that is extremely stressful. And this webinar is meant to provide helpful information to help all of us cope during this complex and difficult time. And we're all doing the best we can. And we hope at the end of this 30-minute webinar, we're able to share some thoughts and specific tools that will help you go forth and share this with others in a way that will decrease some of the stress associated with this. Next slide. So today I'm going to talk about the psychological impact of COVID-19, how we can protect and maximize what we see as constructive coping, decrease destructive coping, and then my wonderful colleague, Dr. Gala, will talk about some of the ethical issues faced during this pandemic, and Crystal Schiller will talk about how we can improve well-being. I'm the chair of the UNC Department of Psychiatry. Dr. Gala is the vice chair of clinical services, and Dr. Schiller is co-directs our women's mood disorder program, perinatal program, and is a very skilled psychologist and clinician scientist. Next slide. So the psychological impact of COVID-19 is profound, and all of us are wrestling with it in different ways. Next slide. One of the things we're seeing is that there's an enormous amount of uncertainty, ambiguity, complexity, as everyone tries to figure out which end is up when they feel like their world's been turned upside down. Each of us will then experience a vast range of emotions when we're confronted with this type of crisis, and each individual is going to have a different set of coping skills based on what you learned as a kid, what you do as an adult, how you've responded to other crises before. I think that there's anxiety that both our own and from those around us, how we all deal with the uncertainty and a constantly changing situation with data bombarding from all sides. That's very worrisome. Many people are having difficulty concentrating. Some people are feeling very much on edge. They easily startled. We can call that hypervigilance, feeling very intense and very jumpy. This can cause a lot of irritability. People have a short fuse, are angry, feel like everyone's getting on their nerves, especially if they're then quarantined at home, or certainly when they're working for our healthcare providers in very stressful circumstances. Some people are engaging in what we call catastrophizing. The end is near. They can feel overwhelmed with that and are unable to take a step back and have sensed that this is a difficult time, but we will get through it. Some people are locking into belief systems that may be completely inaccurate. Deciding that COVID-19 only impacts older people, and for some of our younger people who we really need to be following the rules of physical distancing and really following the rules about staying home, are not doing that because they may have locked into a belief system that in fact is not accurate. Others are engaging in altruism, selfless concern for the well-being of others, and diving in many different ways to try and serve their communities, the patients they serve, or the organization. And then there's people that just love to engage in good old denial. Everything's fine. There's absolutely nothing to worry about. Let's just carry on and sort of try and block out everything. And All these things are very real and human coping mechanisms. And you may notice in yourself you're doing some or all of this over the course of the day, and other people are only picking a few, not consciously, but that's just what they're doing to get through. Next slide. What this means is that we are all going about this and doing the best we can, but it can cause conflict. If I have a very stressed, anxious, hypervigilant form of coping and someone else is engaging in denial and wanting to say, party on, all is fine, this can be really difficult if this is someone you're living with or someone you have to work with and you're coming to this situation with very, very different ways of coping. So one of the things you can do is really just highlight this if you're noticing conflict in your life and with others and say, hi, I'm approaching it this way. I see you approaching it that way. Can we sort of come to some middle ground, or at least understand that we're all getting through this the best we can? Next slide. Common psychological symptoms to stress, and certainly this is an extreme type of stress. People may be fearful, worrying about their own health or the health of their loved ones, having changes in sleep or eating patterns. Some people who are stuck at home are engaging in COVID-induced excessive snacking behaviors. I'll talk in a bit more that may be in COVID-induced excessive alcohol, tobacco, or other drug use, difficulty sleeping, difficulty concentrating. All of this can make it extremely difficult to function in the way we want. And so today we want to talk about what are constructive ways, positive ways of trying to cope versus minimizing destructive ways. Next slide. Destructive coping skills may be what you see here with Nicolas Cage and Elizabeth Shue in the 1995 movie Leaving Las Vegas, people drinking themselves into oblivion, using other drugs, doing things that are really very destructive. People can start feeling overwhelmed. People may even have suicidal thoughts. If you're having anything like that, then reaching out and getting help becomes really critical. So really trying to take a step back and ask yourself, am I coping with this in a way that is positive and constructive, or am I dealing with this in a way that's really destructive? Next slide. And panic is not going to help. So this is an NPR piece that is a graphic I took from it, but panic leading to chaos does not make it better. And I think we all feel like there's this swirling hurricane that's hitting other places, maybe hitting us. What does that mean? Panic leading to chaos is not going to make anything better, that's for sure. So we all need to engage in ways to really try and take this minute to minute and hour to hour in as a constructive way possible to support both our own immediate families and those around us and our coworkers. Next slide. So what is that? When I say let's be constructive and positive, what am I talking about? I think doing something constructive that can be helpful, one of the things people need to do is fill their time. And so it's really important to figure out, how can I contribute to this cause? And I'll give some examples coming up. How can I contribute in a meaningful way to helping us all get through this and figuring out what that is and being very intentional about it? You have to take breaks from watching, reading, or listening to the news. It just can be relentless. Limiting time spent on social media and just sort of being caught up in the echo chamber, which can be overwhelming. Monitoring your own stress response and stepping back and saying, how am I dealing with it? What coping mechanisms am I using? Are they positive, or are they actually pretty destructive? What are others observing about you? Having a really frank conversation with someone that knows you well and saying, what are you seeing? What am I doing that you think is positive or less positive? And what can we do to support each other in figuring out more positive and constructive ways of coping? Figuring out what you're doing about your own self-care and healthy behaviors. Doing some sort of exercise becomes really critical. There's so many different online exercise versions that you can pick from. What are you doing with eating? What are you doing with ensuring sleep? How are you engaging in social interaction virtually, even though we must be physically distancing? And there's like a whole world of new information on how you can do all sorts of fun ways of having Zoom cocktail parties. Connecting with others, sharing your feelings, and then seeking formal mental health support. And I'll specifically talk about what are options at the end of this today. But while having a glass of wine or two at the end of a stressful day is fine, drinking the entire bottle or moving on to 2 is not fine. And we can extrapolate that to any number of different substances, but really trying to be mindful of how you're treating yourself, and are you just trying to numb yourself in ways that's going to be really destructive. Next slide. There are many examples over the centuries of how people really rise to the occasion under really dire circumstances. Anne Frank, who many of us know as a young woman who lost her life during the World War II, and Nazis took her to concentration camp, but her diaries have lived on. She was Dutch, and she's talked about how wonderful it is that nobody needs to wait a single moment before starting to improve the world. And I think for all of us, one of the most constructive ways that any of us can approach this is figuring out, what can I do to try and improve the world right now, given the situation we're in. Next slide. Other quotes that give inspiration: Albert Einstein saying, "In the middle of difficulty lies opportunity." Lee Iacocca saying, "In times of great stress or adversity, it's always best to keep busy, to plow your anger and your energy into something positive." And Ziggy Marley saying, "Doing something that is productive is a great way to alleviate emotional stress. Get your mind doing something that is productive." This can be any number of things. We've seen really productive things and really generous ways that the communities are coming together. College kids helping with babysitting, or helping to deliver food to elderly people that shouldn't be leaving the house and interacting, engaging in online ways of supporting people. How can you contribute at work? How can we help support each other? There's so many different things that any of us can be doing. Certainly our healthcare providers on the front lines, how we can support them, how we can support our communities, how we can support our students, how we can support our friends and neighbors. So really trying to figure out, how can I do something that's going to be productive, that will get me out of my own sort of head and just thinking catastrophic thoughts and engaging in destructive ways of coping. Next slide. So healthcare workers in particular face unique stressors and absolutely need emotional support. It has been extremely hard for all of us to watch what's happening in New York City. I think many, many healthcare workers are feeling profoundly stressed, and they have to engage in self-care to get through this crisis. This is not something that the overwhelming majority of people can go out alone. What does that mean? There's lots of tips on this. Some of it comes from the military, some of it comes from other organizations, and I've tried to reference these throughout, but really doing self-monitoring and pacing, thinking of this as a very long marathon. This is not a sprint. Working in partnership or in teams, figuring out how you're going to take breaks to relax and decrease stress, making sure you're maintaining social connection with family, friends, and colleagues, even if just virtually. You have to have time out for basic bodily care and nutrition, doing active coaching, active mindfulness, active mental health intervention to help you get through this. Really trying to engage in positive self-talk so that the fear doesn't become overwhelming. Trying to focus on what things are within their power and not within their power, not trying to heroically think you can save the world on your own. Acceptance of situations they can't change, and fostering a spirit of fortitude, patience, tolerance, and hope. That is not easy, and reaching out to get help is incredibly important, and we're going to give you specific resources and tools to help manage this. But this is a very difficult environment, which means we must all be supporting our healthcare workers and those around us to navigate this as best as possible. Next slide. So many of the things that healthcare workers are dealing with bring up very complicated ethical issues. And my wonderful colleague, Dr. Gary Gala, is going to share his thoughts on some of the ethical issues faced during this pandemic that are relevant to our healthcare workers, but are relevant to all of us as a society.
Thank you, Samantha. As Samantha said, I'm part of the Department of Psychiatry. I'm a psychiatrist, but I also co-chair the Hospital Ethics Committee, and I've been asked to participate in the healthcare system's response from an ethical perspective in terms of looking at what guidelines we're going to adopt to help us get through this at this time. There are many ethical issues that could be discussed, and I'm just focusing on a few that I think are really specific to healthcare workers. Next slide, please. So first of all, I think it's very important to emphasize that we are one team. Really, it does not matter what role someone plays within the healthcare team. We're all working together, and really we are all vital to the success of the mission. The mission will involve taking care of the patients we usually take care of, and then taking care of the large number of COVID patients that we may have to contend with. I can't emphasize this enough that I view this as an ethical obligation to view ourselves as a team. And as Samantha pointed out, that when things get stressful, it may become difficult to work with certain team members, but I really view this as an ethical obligation that we do everything in our power to work in a positive and cooperative fashion as one team, and that we try to work to reduce conflict. Conflict can arise, as Samantha pointed out, destructive coping mechanisms can lead to anger, irritability, and other outbursts. And I think it's important that we are aware of that, and we are aware that that may arise in other team members, and that we are prepared to intervene in a positive way, reminding all of us that we need to work together. Next slide, please. As Samantha pointed out, taking care of yourself is an important matter. And in the healthcare world, you're taking care of yourself in order to care for others. In normal times, self-care is a good idea, but now I would argue that it's ethically essential that as a member of the healthcare team, you are taking care of yourself. Because frankly, and as many of us are seeing, unfortunately, throughout the world, no healthcare team, no healthcare. We are the folks that are trained to work in this environment. And that's going to involve things that Samantha mentioned, like meeting your basic needs and taking appropriate breaks. But I will also mention in our world today, hand washing and the importance of hand washing, as well as following the guidance and physical distancing and other infection exposure recommendations, which, as we know, are changing on a daily basis. Please be environmentally aware, be extra careful, and see if other folks on the healthcare team need help. This is a nice point that Samantha made about asking others how they think you're doing and encouraging other members of the healthcare team to ask you that as well. And we all are mindful of the risks involved to our family and our loved ones, so it's very important that we practice as much as we can these basic ways of caring for ourselves and caring for others when we're not in the workspace, but when we are at home. Next slide, please. I think that one of the major ethical issues that is on the table today is the good stewardship of personal protective equipment. And that includes not just things that we wear, but our cleaning resources. As many of you, I'm sure, are aware, if you've gone to the grocery store, you can't buy cleaning resources. So good stewardship of those in the workplace is a responsibility that all of us are going to face during this time of crisis. We also are being good stewards of personal protective equipment so that the team members who are in the direct line of fire of COVID-19, our emergency medicine and intensive care providers, nurses, and other staff in those environments have the equipment that they need so that they can be protected. And as many of you, I'm sure, are already aware, this means that we're changing the way we do business. For many of us, we are working remotely. That can create certain stresses, and I think Samantha has nicely pointed those out. But it also, I think, is another ethical obligation that we face to try and minimize the spread of infection among our healthcare team. Next slide, please. Finally, last but in no way least, I think we all are going to face some degree of moral distress as this unfolds. Moral distress is defined as that when one knows the right thing to do, but there are institutional constraints that make it nearly impossible to pursue the right course of action. Many people in healthcare have faced this in terms of patients not being able to get appropriate follow-up care or have appropriate housing after hospitalization or be able to afford medications. But now we're going to face a different kind of situation that will lead to moral distress, namely that we may encounter situations in which we do not have enough equipment to do the right thing. We're all aware of the potential shortage of ventilators and other equipment that will be life-saving. And it's possible that we will face that in North Carolina, that the demand for this life-saving equipment will outstrip the supply. This will create a large amount of moral distress in many of our team members. And I want to emphasize not just providers and not just providers on the front line, but really all team members involved in care, I think may find themselves suffering from moral distress. We're going to say more about resources at the end, but I want to point out that I think this sort of moral distress would be the perfect sort of problem that one would reach out to the well-being program for, and more will be said at the end. There are many ethical issues that we could take on. I've just touched on a few, and I'm going to stop there for now. Thank you.
Thank you, Dr. Gala, and for covering that really important topic. The ethical issues are things that we're all wrestling with in our own ways. And I think that one of the things we can best do is really changing our mindset on how we're going to approach this minute to minute and hour to hour. And so Dr. Crystal Schiller is going to talk about tools that can be used to improve well-being and very practical things that you can learn this morning and implement in your own life.
Thanks, Samantha. Next slide. So there are a number of different things that we can do moment to moment to help reduce our stress and to positively cope, as Samantha said, with the challenges that are facing each of us. So next, I want to talk a little bit about how we can do that even in the context of a crisis like the one that we're facing. So a really good example of this comes from Viktor Frankl, who's a psychiatrist and wrote the book, The Man's Search for Meaning. He once said, everything can be taken from a man, but one last thing, the last of human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way. And that's what we each have to do now to manage this on our own. Next slide. And there's a vast literature to support our ability to do this. And so the one way of managing stress and anxiety in a crisis is to cultivate a sense of psychological flexibility. There's a type of psychotherapy called acceptance and commitment therapy that allows us to do this. And this is the model from acceptance and commitment therapy. And I'll be talking a little bit about this today. And it's not that important to know the specifics of this, except to note that there is an evidence base for it. Next slide. So the first and primary way that we can manage stress during a difficult time is to get present. A term for this is mindfulness, and mindfulness may evoke a whole bunch of ideas that you have about what it means, but essentially it's just the practice of returning your attention again and again to the present moment. There are a number of different ways that you can do this, and a simple one that I've been teaching people is to contact the present moment through your five senses. So I'm going to lead you through a little exercise now. And so what I'd like you to do is start by looking around the room that you're in. Notice the colors in the room. I want you to find everything in the room that's blue. So just make a little mental list of the things that you find. Next, find everything in the room that's green. I want you to listen to the sounds that you hear in the room. You can hear my voice. There may be other sounds that you can hear as well. Sometimes it's helpful to close your eyes. In the silence, I can hear the birds outside. Maybe you can hear them too. Smell the scents in the room. Take a couple of breaths in through your nose and out through your mouth. See if you could smell anything. Taste the flavors in your mouth. Focus your attention there for just a moment and see if you can notice maybe the toothpaste left over, coffee you had for breakfast. Feel the air on your skin. Does it feel cool or warm? Notice the places where your clothes touch your skin. See if you can find one place and hold your attention there for just a couple of seconds. And now you've contacted the present moment through your 5 senses. The cool thing about this exercise is that you can do it anytime, anywhere. Nobody has to know you're doing it. Only takes a minute. And it can be really helpful to return your attention to the present moment, because anxiety is really defined as future-oriented fear. And so when we're thinking thoughts about what may happen in the future, you may find that your anxiety increases, and then you have more catastrophic thoughts about what may happen in the future. And this becomes a vicious cycle that's really difficult to escape from. And so this 5 senses exercise and any other kind of mindfulness exercise is really designed to return your attention to the present moment so you can get out of that anxiety trap. It's been supported by hundreds of research studies, and I like that 5 senses exercise because it's really simple. It's a nice starting exercise, but there are lots and lots of different mindfulness exercises and meditations that you can use to do this on your own. You can get apps and do this. But I think one important thing to note is that mindfulness is like a muscle. So the more you exercise it, the better it will work when you need it. So while you can use this when you're feeling really anxious, you could also use it once a day, like when you wake up in the morning or in the evening before you go to bed. And you may find that you get better at it over time. So there, like I said, lots of different ways of doing this. You can pay attention to your breathing and just notice how your breath feels when it moves in and out of your body. You could take a mindful shower and notice how the shampoo smells and how the water feels as it's touching your body. You could, when you're driving in to the hospital for work each day, notice how the steering wheel feels on your hands and how the sunlight shines on your car. There are lots of different ways of doing this. All right, next slide. Can I get, there we go. So both Samantha and Gary talked about the importance of self-care. I'm mentioning it again here because I think it's so important to think of ways to care for yourself during this time. And it may have to be flexible. So that same run that you used to take on a certain path at a certain time of day may not be possible right now, but you could still step outside and go for a run, even if it's just for a few minutes. If you are a healthcare worker in the hospital, you can run up and down the stairs. There's lots of different ways to move your body right now. As Samantha mentioned, a lot of different apps and videos that you can do at home. And also other important ways of taking care of yourself are obviously making sure that you're drinking enough water, eating healthfully, getting sleep when you can get it, and then making sure that you're still engaging with your social network, even though you're physically distancing. Next slide. Because after all, connection is why we're here. It's what gives purpose and meaning to our lives. And so you may think it's sort of indulgent or superfluous to be, reaching out to friends and making sure that you're building time for social connection each day, but it's critically important. And if you're a healthcare worker working long hours, it can be especially important to make sure that you're connecting with people. And it could even be through a meditation, like a loving kindness meditation, where you're holding that loved person in mind and sending them well wishes. Next slide. It's really also important to do something pleasurable every day. So behavioral activation therapy is another kind of therapy, and it's been demonstrated that certain kinds of activities can elevate our mood and reduce stress. One of them is social connection, but another is experiencing pleasure. There's lots of different ways to experience pleasure every day. The woman in this picture is listening to good music, and each of us has access to do something little for ourselves every day. The key is not to overindulge in things that are bad for us in ways that we experience pleasure, to do this in moderation. All right, next slide. Can also be helpful during this time to reflect on why you got into this work in the first place. What values are important to you as a person and as a professional? Next slide. And I usually do this exercise as a guided exercise that takes about 30 minutes, but I'm going to give you the abbreviated version today since we're short on time. So I'll have you write down your 3 most important values, principles that sort of guide your life and decision making. These things may include empathy, health, family, faith. And for each value, write down a few barriers or things that get in the way for you, especially right now. Next, I will have you think about what it could be like if you could honor these 3 values every day, even through this crisis. Because after all, these are the things that people are going to remember about you during this time. You know, that you really stepped up and helped. That you gave people the social support that they needed, that you were always there as a friend. So I want you to set one goal. Psychologists talk about SMART goals, but essentially these are just specific and measurable things that you can do to support those goals. So let's say your value is health, and you've been neglecting getting physical activity during this time. One SMART goal would be to get outside and jog for 5 minutes each day. So you also want it to be achievable, and that's the trick. You have to think about outside the box about what you're ordinarily doing to support these values and think about them in a slightly different way. All right, so with that, I'm going to end my remarks. Morgan, can you go to the next slide? Thanks.
Well, thank you, Dr. Schiller. That was fantastic. Enormously helpful, useful, and accessible tools we can all use. Next slide. I want to call your attention to things we've put together. So with thanking UNC School of Medicine, UNC Physicians, UNC Health for amazing resources. We have at the UNC Healthcare Wellbeing site support for coping for COVID-19. If you click on that, you'll see a large number of resources. There's a free hotline, there's free phone counseling. Next slide. There's a vast list of resources for wellness, for our healthcare providers, for our physicians, for others. We have really tried to figure out how we have different groups support through the employee occupation program, through formal mental health support, through online and web resources. We want everyone to reach out and get help they need. Next slide. And what you will see here is the Department of Psychiatry for people really feeling overwhelmed and feeling that normal ways of coping are not working. They're trying online resources and they feel like they need direct support. Our entire outpatient program has been converted to telepsychiatry, and we are open for business, albeit virtually, for outpatient care. Here's the information. Here's how you contact us. And Dr. Gala and Dr. Schiller and I and all of our wonderful colleagues in psychiatry are working as hard as we can to make sure we can meet the needs. Please reach out for help. We want to be able to help. So I want to thank you all for listening today. We want to, again, our central message is this is a difficult time. We are confronted with things that are unprecedented. And we have to pay very careful attention to our own psychological health. How we're reacting, how are we supporting others around us, and when to reach out and get help to ensure we can do as best as we can given the circumstances. So thank you all again, and we wish you well as we get through this together. We will get on the other side of it. Things will get better, and our world will get back to much of what it was, although probably not unchanged in some ways. But we are sending you our support and want people to access the resources we've put together. Take good care. Thank you.